The death toll from the new coronavirus has exceeded that of the severe acute respiratory syndrome outbreak in 2002 and 2003 in mainland China. But the number of people who have recovered nationwide has also risen in recent days, suggesting that the new virus's fatality rate is relatively low. China's Health Commission reported on Sunday that there were 475 recoveries and 361 deaths nationwide. During the SARS outbreak, 349 people died in mainland China. Health experts say they are encouraged by the steady rise in the number of recoveries. They take it as evidence that the treatments meted out have been effective and that the virus does not appear to be as deadly as SARS. SARS had a mortality rate of 9.6%, and about 2% of those reported to have been infected with the new coronavirus have died. China first announced an outbreak of a mysterious pneumonia in the city of Wuhan on December 31. It has been 12 days since the authorities began to place the city and much of the surrounding Hubei province, home to tens of millions of people, under lockdown. Here's what early research says about how the pathogen behaves and the factors that will determine whether it can be contained. In Hubei, the epicenter of the outbreak, 80 patients had recovered on Sunday, compared with 56 deaths. On Saturday, 49 patients had left the hospitals, while 45 people had died. Still, the number of infections from the new coronavirus continues to climb, suggesting that it could take a while before the outbreak ends. China had 17,205 confirmed infections as of Sunday. During the SARS outbreak, it had 5,327 cases, according to the World Health Organization. Stocks in China plunged in Monday trading as investors returned from a long holiday to the prospect of the world's number 2 economy virtually being shut down by the coronavirus epidemic. Stocks in Shanghai dropped 7.1%, while shares in the southern Chinese boomtown of Shenzhen fell 8.4%. The markets had been closed since January 23 for the Lunar New Year holiday, and that closing was extended until Monday while the authorities dealt with the outbreak. Other markets in the region, which have already digested much of the impact, were also trading in the red. Shares in Tokyo finished the day down nearly 1%, while in Australia they closed down 1.3%. Stocks in Hong Kong opened down, but later paired those losses and were flat. The damage could be confined to Asia. European markets started the week in positive territory, and futures trading that predict the performance of stocks in the next day forecast a positive opening for Wall Street. Separately, China's central bank moved to pump $173 billion into its financial system on Monday in an emergency move to help government efforts to contain the coronavirus outbreak. The virus has sickened more than 17,300 people in China and 23 other countries. Chinese officials tried to reassure the country on Monday that a shortage of medical supplies was being alleviated, that the food supply remained adequate, and that food prices, which had been sharply rising, were stable. Tian Yulong, an official from the Industry and Information Technology Ministry, acknowledged the shortages of basic medical and health supplies, but promised to fix them soon. Describing the availability of medical protective clothing and masks as a delicate balance, he said that 154,500 sets of protective clothing and 133,600 high-quality masks had been shipped to Hubei province, the center of the outbreak, by Sunday. The Vatican also said on Monday that it had sent several 100,000 face masks to Hubei and to Zhejiang and Fujian provinces to help contain the virus's spread. Regarding rising food prices in China, which were a concern even before the coronavirus crisis, Lian Wuliang, a deputy director of national development, said that most of China's basic necessities, especially food, would be guaranteed. He said that the average retail prices of pork, beef, mutton, and eggs in 36 large and medium-sized cities nationwide had fallen from previous highs. China's foreign ministry on Monday sharply criticized the United States for its response to the epidemic, saying that it was creating and spreading fear instead of helping contain the coronavirus. Hua Chunying, a ministry spokeswoman, said that the United States had been the first to order a withdrawal of its diplomatic staff in Wuhan, the city where the virus outbreak began, and the first to impose a ban on Chinese travelers, which the Trump administration announced on January 31. In the face of the public health crisis, countries should work together to overcome the difficulties and not shift one's troubles onto others, let alone take advantage of people's precarious position, Ms. Hua said in a regularly scheduled briefing that, because of the epidemic, was held online. Secretary of State Mike Pompeo, traveling in Uzbekistan, said on Monday that the United States was coordinating with Beijing to organize more flights for Americans in Wuhan, and possibly citizens from other countries. He said the administration hoped to use those flights to also deliver medical supplies. We are working closely and hand in hand with the Chinese government to try and resolve what is now this global epidemiological challenge, he said, according to a State Department transcript. Hong Kong's government said Monday that it would close 4 more border crossing points with mainland China, leaving open just 3, as the number of coronavirus cases in the city continues to grow. Carrie Lam, Hong Kong's top official, has been under increasing pressure from hospital employees, the business community and even some pro-government lawmakers to further tighten border controls. More than 2,400 medical workers in Hong Kong went on strike Monday morning to pressure the government to bar entries from mainland China, a number that was expected to grow if the government did not relent. The medical workers, members of a newly formed union, said they worried that hospitals would be overwhelmed as mainland Chinese seek to use Hong Kong's well-respected healthcare system. Hong Kong itself has 15 confirmed cases of infection. Mrs. Lam announced measures last week to cut arrivals from mainland China, including the closing of some border checkpoints, halting cross-border trains and cutting inbound flights. The government also said it would not allow entry by residents of Hubei province, the center of the outbreak, or people who acknowledged that they had traveled there recently. But she has resisted a complete closing, calling such a move a discriminatory approach and not in line with recommendations from the World Health Organization. Signaling concerns among business executives, more than half of American business leaders questioned said they wanted to see Hong Kong's government shut down the border with the mainland, according to a survey of 156 executives by the American Chamber of Commerce in Hong Kong. Russia on Monday suspended passenger rail links to China and North Korea, postponed a major business conference and laid the groundwork to deport foreigners diagnosed with the coronavirus. All passenger train travel to and from China is halted until further notice, said regional authorities in Russia, which shares a 600-mile border with China. Russia's main train operator said it was also suspending passenger service to North Korea in response to a request from Pyongyang. The Russian state-run news service TASS said the move was part of North Korea's effort to combat the spread of the virus. North Korea, which borders both China and Russia, had not officially reported any coronavirus cases to the World Health Organization as of Sunday, but the isolated country has been quarantining people arriving from China. North Korea had also already decided to close its borders to all foreign tourists amid the outbreak, not just those from China. 2 cases have been confirmed in Russia, both of them Chinese citizens, and it was not immediately clear whether Moscow would seek to deport them. Russia's new Prime Minister, Mikhail Mishustin, said on Monday that he would postpone an annual economic forum scheduled to be held at the Black Sea city of Sochi this month. Among the 4,000 registered attendees, about 250 are from countries where coronavirus cases have been confirmed, officials said. From Amy Chin, a China correspondent, and Elsie Chen, a researcher, on the ground in Wuhan. People desperate for treatment started descending on a new hospital in Wuhan on Monday that was built within 10 days after the outbreak of the new coronavirus. But with workers still trying to finish construction on it, many potential patients were turned away. Multiple road checkpoints were set up to screen cars heading to the hospital. A sign at one read, "Only diagnosed patients transferred from other hospitals can be admitted." Officers at the checkpoint told sick people and their relatives to instead call China's emergency number. One man, Shui Ying, was driving toward the hospital with his cousin, who had recently been tested for the coronavirus and was awaiting the results. Mr. Xue believes his mother died from the coronavirus, but they could not secure a bed in a hospital and she was never tested for it. His aunt and uncle were also in a hospital, and he said he was desperate to find help for his cousin. "I can't afford to lose anyone else," he said. About 1,400 military medics will begin working at the new hospital, which covers roughly 365,000 square feet and has been fitted with 1,000 beds. A second facility in Wuhan, with 1,500 beds, is expected to be completed this week. From Amy Qin, a China correspondent, and Elsie Chen, a researcher, on the ground in Wuhan. Weak with fever, and Jian, who awaited in line for 7 hours outside the hospital in the cold, hoping to be tested for the new coronavirus, which doctors suspected she had contracted. Ms. An, 67, needed an official diagnosis from a hospital to qualify for treatment, but the one she and her son raced to last week had no space. The next hospital they were referred to in Wuhan, the city of 11 million people at the center of the outbreak, was full, too, they said. They finally got an intravenous drip for Ms. An's fever, but that was all. Since then, Ms. An has quarantined herself at home. She and her son eat separately, wear masks and are constantly disinfecting their apartment. Ms. An's health is declining rapidly, and even keeping water down is a struggle. "I can't let my mom die at home," said her son, He-jun. "Every day I want to cry, but when I cry there are no tears. There is no hope." For some people, like Gan Hanjiang, the city's new hospitals for treating the coronavirus cannot be built fast enough. Last month, his father came down with a severe fever and cough. He was tested for the coronavirus, but the results were negative. 10 days after the onset of symptoms, however, his father died, Mr. Gan said. The hospital classified the cause as severe pneumonia, Mr. Gan said, but he believes it was the coronavirus. Several experts have recently conceded that several rounds of testing may be needed for an accurate diagnosis. On the day his father died, Mr. Gan began to show the same symptoms, he said. But without a car, he has not been able to go to one of the designated hospitals to get tested. "Getting treatment is so difficult," he whispered slowly by telephone from a small hospital near his home where he was being treated for viral pneumonia. "We can't get admitted to the hospitals. And there's not enough medicine." A day after New York City's health authorities said that a woman hospitalized at Bellevue Hospital Center might have the new coronavirus, the authorities said on Sunday that 2 more patients might also have the virus. Samples from all 3 patients must be tested at a laboratory in Atlanta that is run by the Centers for Disease Control and Prevention to determine whether any of them have the new coronavirus. The turnaround time for receiving the results is usually at least 36 hours, but often longer. Local health departments are not yet able to test for the new illness. Based on the type of symptoms, the patient's recent travel in China, and the exclusion of influenza and other common illnesses, the New York City health authorities are taking seriously the possibility that these patients may have the virus. 3 more cases were confirmed in California on Sunday, bringing the total in the United States to 11. A military plane carrying 56 Italian evacuees from Wuhan landed at a military airport at Pratica di Mare, about 20 miles south of Rome, on Monday morning. One Italian who had planned to return was not allowed to board in China because the passenger showed flu symptoms, the Italian news media reported. Those deemed healthy will be transferred to the Sacchinola military compound in Rome, the Italian authorities said, where they will be under observation for 2 weeks, the incubation period of the coronavirus. Passengers with flu symptoms were to be transferred to a hospital in Rome, where the only 2 positive cases of the virus in Italy have been receiving care. Another 36 people are being monitored at the hospital, including traveling companions of the Chinese couple who tested positive. The Italian Minister of Health, Roberto Speranza, said that his counterparts from the group of 7 industrialized nations plan to discuss the coronavirus in a call on Monday. Hundreds of Australian citizens and permanent residents became the latest evacuees from Wuhan on Monday, after a complicated debate over who would pay for the flights. Australia's Foreign Minister, Marise Payne, said the evacuation prioritised vulnerable and isolated Australians, including 89 passengers under 16 years old and 5 passengers younger than 2. In all, 243 passengers were flown out of the coronavirus epicentre by Qantas to an Air Force base in Western Australia. From there, Australian officials said, they will be transported by military planes to Christmas Island, a location previously used to house asylum seekers, where they will be separated into their families and quarantined for 2 weeks. The process has been tainted by criticism and errors. Human rights advocates questioned the use of Christmas Island, and Australian citizens were initially told they would have to pay $1,000 $670, for the flight, causing many to reject the offer. The government is now subsidizing the cost, and Qantas is covering the rest, including flying people back to their home cities after the quarantine. "We needed to get them out of Wuhan," said Alan Joyce, the chief executive of Qantas. "After the flight, the plane will undergo 2 or 3 days of deep cleaning," he said. While much attention is focused on China's handling of the coronavirus outbreak, medical experts worry about looming problems in Southeast Asia, which has the largest cluster of patients with the new coronavirus outside China. The Times' Southeast Asia bureau chief, Hannah Beach, reports that some governments in the region have either played down the threat of the epidemic or openly expressed worry about offending China, a superpower whose economic heft can propel their economies. On Sunday, the first overseas death from the virus, a 44-year-old Wuhan resident who had died a day earlier, was reported in the Philippines. The virus has spread to about 24 countries. Medical experts worry that a delayed response to the coronavirus in Southeast Asia could hasten the spread of the disease. "Our greatest concern is the potential for the virus to spread to countries with weaker health systems," said Tedros Adhanom Ghebreyesus, the WHO's Director General. In Cambodia, Prime Minister Hun Sen told a packed news conference last week that he would kick out anyone who was wearing a surgical mask because such measures were creating an unwarranted climate of fear. And in Indonesia, the health minister advised citizens to relax and avoid overtime work to stay free of the disease, saying, "To prevent it is very easy as long as your immunity is good." Reporting was contributed by Sui Lee Wee, Alexandra Stevenson, Austin Ramsey, Stephen Lee Myers, Raymond Zhong, Carlos Tejeda, Cao Lee, Gary Mullaney, Amy Cheen, Anton Troianovsky, Joseph Goldstein, Damian Cave, Elisabetta Povoledo, Hannah Beach, and Ko Sang Hun. Claire Fu contributed research.